Assalamu alaikum. Now I would like to discuss about tardive dyskinesia. It's a very important topic. Hope you are going to enjoy. Okay, what you have to know in tardive dyskinesia, that is, in tardive dyskinesia, it usually happens due to taking of first generation antipsychotic. First generation antipsychotics are haloperidol, flufenazine, thioridazine, chlorpromazine. If somebody is having antipsychotic, if somebody is taking first generation antipsychotic, these person may got this tardive dyskinesia. It's one of the extrapyramidal symptoms. In here there is abnormal involuntary movement. So another important word is abnormal involuntary movement. So there is abnormal involuntary movement. So abnormal involuntary movements, when it happens if you are taking uh, antipsychotics, first generation antipsychotics, or metoclopramide. It's metoclopramide. It is given in gastroparesis. It is given in emesis. So these things may happen in patients who are taking antipsychotics, first generation antipsychotics, for prolonged period. What are the clinical feature you may get in such a case? So it's tardive dyskinesia. It creates lots of problem. So LOT, that means limb dyskinesia, that means oropharyngeal or orofacial dyskinesia, and last one is trunk dyskinesia. Limb dyskinesia, orofacial dyskinesia, and trunk dyskinesia. In limb dyskinesia there may be foot tapping, there may be chorea, tapping, foot tapping, chorea, and the final one, it may cause dystonic posture. In orofacial dyskinesia, there may be lip smacking, there may be lip smacking, there may be grimacing, there may be grimacing, and there may be tongue protrusion. And the trunk dyskinesia, there may be rocking, thirsting, and shoulder shrugging, rocking, thirsting, and shoulder shrugging. Okay, uh, one question. Which cranial nerve involvement, which cranial nerve disturbance causes disturbance of this shoulder shrugging? It's accessory nerve, cranial nerve number 11. So another clinical clue you can earn from these things, that limb dyskinesia, orofacial dyskinesia, and trunk dyskinesia. Limb dyskinesia, there may be foot tapping, chorea, and dystonic posture. In orofacial dyskinesia, there may be lip smacking, trunk protrusion, there may be grimacing, and in trunk, there may be rocking, thirsting, shoulder shrugging. What you have to do, in such a case, if you diagnose, neurology is all about diagnosis, that if you are going to diagnose this, stop all the antipsychotics, all the first generation antipsychotic. Like if patient is having haloperidol, stop it, then switch to second generation antipsychotic quetiapine, like quetiapine, like clozapine, like quetiapine, like clozapine, if continued, antipsychotic is required. And as a treatment, treat with VMAT inhibitor like valbenazine, vesicle monoamine transferase inhibitor valbenazine, and deutetrabenazine. So tardive dyskinesia, think about taking first generation antipsychotic. There is a lots of problem: limb dyskinesia, orofacial dyskinesia, and trunk dyskinesia. And as a treatment, stop all the antipsychotics, switch to the second generation, and finally treat with valbenazine and deutetrabenazine. This is a very high yield topic. Hope you are going to enjoy.